heard a lot, I think, today, mostly, if I can say, from the kind of supply side of research. So we've heard a lot about interesting research many of you are conducting. We've heard a lot about the case for the research that you're conducting. But I hope what you'll get from our panel today is a bit of a different side. I think it's billed as the stakeholders' voices, but I think I would think of it a lot more as some of your core customers for this research. And so on the panel today, we have government represented to let us know what it is that they need, what evidence they need, and what informs the decisions they make. We've got finances of early childhood programs and technical support advisors from World Bank and UNICEF. And then we've got an implementing partner to government in the form of BRAC. So I hope through each of these different voices, you'll really get a sense of what the need is from those that are using the evidence that many in the room are generating. So the way we're going to run is I've got maybe a question or two. It depends how succinct and brief our panelists are. And then I am going to come out to you for some questions, because I hope they're going to stimulate some other reflections and questions from your side. And then I'll come back to the panelists for some final words. So I hope that makes sense. And I'm going to start off with Professor Ernest Davis, who's the Director General from the Ghana Education Service. And Professor Ernest, we heard a lot. In fact, one of the first presentations this morning was telling us about Ghana's commitment to pre-primary education, to 2 years of free pre-primary. And once again, Ghana is leading the way in Africa around that. So I'd really like to ask you, how has the Ghana Education Service used evidence to inform implementation of that policy commitment? So I wonder if you could take us through how you've used it, what you've used it for, and what's been useful to you. Thank you.
Thank you very much. And good afternoon, everyone. I would respond to your question by, first of all, highlighting our attitude towards evidence and early childhood education. I will then address your question as to how we have used evidence in our policy commitment and conclude. So, we at Ghana Education Service believe that informed decision-making and practices are always driven by evidence-based policies, or policies that are informed by evidence. So to us at GES, or Ghana Education Service, we are of the conviction that effective policy formulation and implementation are driven by evidence. We mean good and best practices. So for us, evidence is key to policy formulation and implementation. Now, our attitude or our worldview of the child, of early childhood education, we believe that the future is for children. And I guess many of us in this room also have similar belief. If the future is for the children, then we cannot take children out of any future consideration. If we believe that the world is for the children, then we cannot take children out of any future consideration. So we believe that once we are thinking about the children, then immediately we have to prepare the children or the child towards the future. Otherwise, then the future is not for them. So we think that early childhood education is key to the future development of the child and also education of the child. So we are investing in early childhood education. We are investing in policies that support early childhood education. Now, it's true that we are not doing badly, but we think that we still have a lot more to do. Recent literature suggests that 2/3 of our children within the age bracket of 3 and 4 years are developmentally on track. That is, using Early Childhood Development Index. Here we are looking at issues around health, learning, and psychosocial well-being, and others. So that suggests that a third of them are not on track. In fact, 68% are on track, meaning that some 32% are not on track. It suggests that we have a lot of work to do. GES has been mandated by the country to ensure that we provide quality education at the pre-tertiary level, and of course, including early childhood level. So at GES, we execute our mandate drawing on evidence to ensure that our policy commitment around early childhood education is executed the way it should. How have we used evidence to do that? Number
Professor
one.
Ernest, I'm going to ask you if you could maybe summarize for us. I know you've got some key components you want to pull out, so maybe you can briefly do that for us.
So yes, so I'm now touching on that. So how have we used evidence to inform our policy commitment? One, prioritization of where to focus in our pre-tertiary education delivery is informed by evidence. Now our focus is on early learning. So international and national assessment, and then international research, including the one I just mentioned. The data I just gave is from UNESCO studies on the Early Childhood Development Index. And these pieces of evidence inform our priority on early learning. So what level to prioritize now is early learning. It's informed by the evidence, both local and international. Number two, when it comes to policies and standards, we also draw on evidence. We have our Education Strategic Plan 2030. We have early learning and development standards. We have our early childhood curriculum, which is driven by play-based pedagogy. If you look at key players such as Lively Minds and other big projects in Ghana, they push play-based pedagogy. It's been positioned as developmentally appropriate pedagogy that helps the child to enjoy learning. We heard this morning. These evidences are driving our curriculum. We can also look at even our curriculum delivery system. We draw on data from our information management systems and school-level data to inform resource allocation, to inform decision on enrollment, teacher deployment, learning outcomes, to monitor the way our district and regions are doing in order to decide on which intervention will be appropriate. We also use evidence to improve our practices by monitoring what our interventions are doing. I will touch on teacher training. We use evidence to inform teacher training. For example, Lively Minds ECE parenting programs is one of the key projects that has given true meaning to parents and then school collaboration. Through this program, parents are prepared to support children in their literacy and numeracy development. Otherwise, in the past, parents are only informants, but now they are actively involved in the child's development, and it's through this project. And the project has trained a lot of teachers to equip parents to do that. So the evidence is informing teacher training, in-service teacher training. It has also led to development of curriculum framework for teacher development. I will also talk about partnerships, because partnerships and pilot, we have worked with our international partners to sustain the generation of evidence, because once we get the evidence, we use the evidence, we'll finish, but we need to generate new evidence every now and then and use that to inform practice. So we have worked with Lively Minds, Sabre Trust, Thrive Ghana, Innovation for Poverty Action, to pilot scalable models and generate rigorous impact evaluation. I think if I want to go, I will keep going.
Yes, because I want to stop you there for a reason. I promise you I will let you keep going at some point, but I want to stop you there only because you have ended on a point that I think is important to bring Amanda in on. So am I allowed?
Yes,
okay.
Please, thank you.
So Amanda, this last point here about partners and their support to generate evidence. Now, you have led you've led the World Bank's work on early childhood for many years now, and the World Bank is really one of the foremost, not just financiers of early childhood programs globally, but also very rigorous and great technical advice and support. So I wonder if you could give us a concrete example of where you have seen evidence inform policy implementation, or even better, policy implementation and scale up. So just take us through that journey and sort of pull out for us what have been some of the key ingredients. And can you do this in 5 minutes?
Yes. Well, I don't know, we'll see. But I'll try. So I think when we're talking about evidence, there's probably 3 different kinds of evidence that come to mind. So the one would be the why, right? Why should we be investing in early childhood development? How do we make that case to countries? The second would be the what. What should we do once policymakers are convinced? And the third is the how, right? So how do we do it? I think that the first 2, the why and the what, are easier than the how. And I'd like to suggest that we might spend too much time and money and effort on the why and the what right now. And that was probably appropriate 10 to 15 years ago, but probably now a little bit more on the how. So I want to, and I think we should get evidence as quickly, as cheaply, but making sure it's good enough to go with today's theme as we do this work. So let me give you 2 quick country examples. So the first is work in Uzbekistan. And Uzbekistan was actually the first country I worked on for the World Bank about 15 years ago. And at the time, the government had about $50 million in finance available to support a basic education project. $25 million was a loan, $25 million was a grant from GPE. And truth be told, what the government wanted to do was procure as much hard stuff as possible, right? So this was 15 years ago. They wanted whiteboards, they wanted computers, they wanted hard stuff. And in that negotiation, we were able to talk to them and say, you know, okay, we see the value in that, but also, can we do some analysis on your early childhood development programs and help you think about how investing in early childhood education might be able to help with some of your learning outcomes. And because that GPE money was a grant, it was $25 million of grant money, they were more willing to be tempted, or at least to entertain the idea of investing in early childhood education. So what we did was we did a relatively quick and cheap analysis looking at Uzbekistan's early childhood education outcomes, and we were able to show the government that they were spending 2 to 3 times more than their neighboring countries, but getting worse outcomes in terms of child development. We were also able to show them that what they were measuring was probably not the right stuff. What they were measuring, they were actually assessing children every single week, but they were doing it mostly on physical development. We were also able to show that the model itself was still sort of a post-Soviet 12-hour, highly institutional model that was very expensive, with separate nap rooms, separate cooking rooms, it wasn't very play-based, it wasn't good quality. We also just did basic analysis looking at the infrastructure and the teacher qualifications and teacher quality, and we were able to show that the regions that had worse infrastructure and less qualified teachers had lower enrollment, and that tended to be the rural areas. So we put all of that together in a story to the government to say, you're spending more money than you need to, we can help you spend less money, we can help you monitor the right things, and we can work with you to design a half-day program that is play-based, that is focused on rural areas, and we also recommend that you invest more on your rural infrastructure and on your teacher training and allocation mechanisms in rural areas. And they agreed. And so now, I think at the time, Uzbekistan's early childhood education rate back in 2010 was about 18%. Fast forward 15 years, it's 80%. Now, that did not happen magically. There were 3 successive projects, and over time, they kept improving, rolled out rural models that were more using a bus system, models focused on children with disabilities, public-private partnerships in urban areas of the countries. So just little by little improving and sticking with it. And I think that's really critical, and that's where we all fall down sometimes, right? We think like we're gonna design this one thing, and it's gonna work in a pilot, and then we're gonna scale it, and we're gonna be done. And that's just not ever the way it's gonna work. And there were plenty of missteps along the way, right? The government reorganized 3 times, I think, in terms of setting up a preschool ministry, then deciding that wasn't the way to go, moving to a preschool department. There were bumps along the road, but overall it's been a positive trajectory. And I was gonna give you a Morocco example, but I'm gonna stick to time. But can I close with 2 quick things? Or
I hope
Morocco?
What you're closing with is going to be about, I loved this ending here where you're pulling out what have been some of the lessons learned. Is that kind of where you're taking us?
That is where I'm going. Yes.
Take us.
Yes, but the Morocco story is really great, and I'll be happy to tell anyone
over coffee. Morocco over coffee.
Right, so the first takeaway is focus on implementation. And the takeaway that was gonna come through the Morocco story is the implementation partner matters. And I think, again, too often we design pilots that work well with a local or international NGO, and we've designed them with the government in mind, but there's not a system in place to implement this approach effectively at that middle scale, right? So I think it's having a strong implementation partner, but also working slowly on that middle part of scale when you go between pilot and between when you're national, really taking your time and getting that right. And then I think the last thing is a little bit intangible, it's luck, right? And we were lucky that we had that moment in Uzbekistan. And if I had told you the Morocco example too, one of the things I would say is that Morocco and Uzbekistan are both countries with a very specific kind of government that things get implemented, and they get implemented the way they are meant to be implemented, and everyone does exactly the job they are expected to do in the time frame they are expected to do that, and that is not how many governments work. And that's a reality, so.
Great, thank you. And actually, that last part, you won't believe me, but they didn't actually know necessarily what I'm gonna ask them and each other, but that last point, so your last point led us to her, and her last point leads us to Munshi, which is about the right implement. You say, no, Eva, you've got a cracker coming last. But Munshi, I like this point about the implementing partner, and I know I think BRAC is so well known to many of us as a very well-respected implementer that really does base a lot of their interventions based on evidence. And I know that right now you're engaged in quite a rigorous RCT looking at childcare model, I think, looking at outcomes for women's economic empowerment as well as child development outcomes. Now, I don't know about everyone else here. I cannot hear about another RCT today. what I actually want to hear about is what's the point? So what is it you want to achieve with this research? What is the change you're hoping to make with this research? A little question for you, Munshi, don't worry, and you've got 5 minutes.
Thank you. So to pick up from what Amanda was saying, so the study or the project, let's just call it a pilot, not an RCT, RCT is a part of it, is about answering the question of how. So we are convinced about childcare development, childcare services and child development. Now, how do we scale it? And what I find particularly exciting about the project that I'm working with BRAC now is it's taking a market-based approach. Now, BRAC has sort of previous examples of taking market-based approach, but not many that are successful. But the basic premise is if there is some sort of a coordination failure to begin with, you need an intervention that addresses this coordination and you become irrelevant. So that's one of the sort of silver bullet type of things. So we do have examples of sort of addressing this type of missing market in Bangladesh context, like poultry sector or AI for artificial insemination of the, what we'll talk about next session. But so we've learned from there that it becomes either irrelevant or you make money out of it. So the approach that we are taking is essentially entrepreneurship model. We are still looking at mothers, children as outcomes, but the main thing is if we can address this problem of there might be enough mothers who want to avail this service, at the same time there are potential entrepreneurs who are living in these communities, they would like it to be one of the things that they do as a livelihood, but somehow they're not able to coordinate amongst themselves to figure it out. And if we can solve that problem, we will be done. So it's in the, so we're halfway through the implementation. We're done with the 6 months of intervention phase a couple of months ago. And in the RCT, we had 150 treatment clusters and 50 control. Out of the 150, 2 months post-intervention, we still have 140 up and running or providing their services to, on average, 3.5 kids. Earning about $80 per month on average. I actually have a little bet going on among my team members, asking them how many of them will survive till January, and whoever can guess the right answer will get some reward. But the guess is between 40 to 100. Even if it's 40, I think that's quite commendable in the sense that you have done a survey, an intervention for 6 months, and 8 months down the line, 40 of them are still providing services, and we'll see how much the mothers are able to earn by keeping the children with these childcare providers, if that is enough to make this a sustainable thing. I'll end with one last thing.
Yeah. I've got one question for you, though, before you say your last thing, which is, so is the vision that, so what you're testing out now is whether this market-based approach could work, and you get this kind of sweet spot of entrepreneurs who are in a position to provide this service, providing a service that there's demand for. So kind of, what would be the vision of scale? You're expecting someone who to do what for this to, let's say it all works, it's great, you've got the market there. What's the next bit?
So the next bit would be coming up with a much cheaper model. And I do have an idea of the cheaper model, and that's coming from the control group. So as it happens, in the control group, out of the 50, we have found so far, 4 of them have started providing childcare services. And all we have done is conduct a survey asking them, if we had this type of service, would you be interested? And somehow, for these 4, that was enough. Now, that mocks up my RCT, control, but, I would take still that, and maybe the next RCT would be just doing that bit. And eventually, the idea would be we just do enough, and there are enough spillover effects. Someone just gets that idea, visits a childcare provider, and that's enough, or maybe work there as a paid worker, paid assistant, and that is enough for them to start these services. So that ultimately, at least within the urban setting where we are implementing, the next would be trying to find out where these sort of more spontaneous service providers can come up, where would need for less intensive intervention that you have done in these sort of 6 months.
Great. Thank you very much. Thank you. So Eva, I'm coming to you last but not least. You've worked for UNICEF for many years. You're worried about what's coming.
I don't know what's coming.
For UNICEF at different levels for many years. And what I'd like to ask you about is something that I think we don't often ask ourselves, which is, are there any other major evidence gaps that you think we've got? And it might relate to these last 2 points around the how. And so tell us what you think those gaps are and what you think, or how you think we may need to go about filling in those gaps.
Okay. I have two parts of
Go
the answer. And my perspective is, I mean, I realize it's actually so nice to be in an audience with academics and researchers. It's been a long time that I've had that opportunity. But sitting at UNICEF, my perspective is very much from the lens of working with governments and supporting governments in terms of developing better systems for children, right? So, and I do think we're after the same goal. Even hearing today's presentation, actually a lot of what everybody's talking about in terms of the RCT and the programs, we are all trying to do the same thing. So take what I'll say from the perspective of the partner who literally is accompanying the governments through these reforms and initiatives. So I think we have two problems, and many things that are working, but two problems. First problem is I think we are actually still answering old questions, and I mean we're kind of in a backward space in terms of what governments actually need and want nowadays, and I'll say something about this in a minute. And the second one, which I know sounds dissonant, we're not forward-looking enough. So we're stuck in kind of in the space around reforms and public policy that isn't answering actually the questions that governments have, and it relates to what Amanda was saying. But on the other hand, and I really took Mark's message this morning, it resonates perfectly in terms of what we're seeing with governments now. We are not prepared. We're not actually developing evidence and research agenda for the future that's coming, and it's already here, and we're actually still reacting to things that are kind of from the past. So I'll unpack very briefly both points, and maybe we'll come back to that afterwards. On where we are with the evidence around implementation. I mean, I've been in this field also 20 years. I feel like we've been talking, first we were talking about translating basic research into implementation research. Now I feel like we ought to be talking for a long time already, translating implementation research into systems and reform research and evidence, because this is what governments actually need. No government partner comes to UNICEF and says, we want, tell us the one program that we're going to implement. They're coming and saying how. We're done with the advocacy. Let's hope that the advocacy part, we know the why, we can package it even better, we don't need to replicate the same studies country after country. They're asking us to think with them and to accompany them on a real systematic evidence-driven reforms. And here, for all of you researchers, I would push us to think, you know, when we implement programs and develop evidence for interventions and programs, which is different than developing evidence for reforms and public policies, we think about theory of change of the intervention, and we keep trying to test the theory of change in a petri dish in some ways through the RCTs. What does that look like to test the theory of change of a reform and of a real public system building, right? Because that's actually what governments are asking us to do. And the theory of change of a reform is not one or two things. You have to work with the whole system. You have to model to the government how this program is going to fit into an existing primary health system or social welfare system or an education system. And here, no one size fits all. Every country and every system is different, but the questions that the governments are asking UNICEF, I think, are very telling to where we need to go with the evidence building. They're coming and saying, we understand that parental counseling is important, but help us through examples, through comparative system models, roadmaps, blueprint, to help us make the right decision. How do we make parental counseling part and parcel of the primary healthcare system in Ghana or in Uzbekistan or Montenegro? And that looks different across the board. But what are common principles? What is the blueprint? What is the system alignment that needs to come together to make that reform stick and to make sure we're moving not from just costing the pieces in the reform, but actually finding pathways to finance it. Because to me, that's the other big thing when we talk about moving from implementation science to reform science. Because we need to help governments design and develop the right reforms and initiatives, but we also need to help them find ways to finance them. And let me tell you, you all know the world is changing so fast that I think the old ways of financing is also out the window. So we have to be forward-looking and seek new ways, I think, and new pathways to finance some of the work that's happening. So I would say on the old questions, we need to flip it and look into what does it look like to do evidence generation for real system reforms. On the new questions, I'll be super brief because this is we can talk about this forever, but I think as a field, we are still super reactive. I mean, and I speak on behalf of UNICEF too. I have this conversation with UNICEF all the time. And we have no clue yet, I think, in terms of what is the impact of AI or technology on digitalization or shaping parental choices or on shaping child cognition. There's such big questions ahead of us on hybrid models of service delivery. That's another big one for us. Governments are making decisions now around introducing digital platforms to deliver services without any evidence from the field. I have not seen strong evidence to say, what is a good hybrid human-centered technology and human-centered model look like for delivering parental support, for example? And these are big questions, and I think we're still kind of stuck on the program side with questions that, talking about programs that we already know what more or less makes them work, and we need to move into the system, while we're not looking far advanced ahead of us to say, mental health, digitalization, AI, climate, I mean, these are big things that sooner than later are going to be too late, because we need evidence to make sure that when those reforms come in, and they should be coming in now, we already know some of the what's in order to do the how better. So I'll stop here. I don't know.
Thank you. No, excellent. And you even took us to what might be some future topics that we might want to dig in deeper. Although I do think some of the things you raised, like mental health, climate, and AI, I at least am definitely seeing much more of a focus of that coming through. But I think that also point of Amanda's about how we might accelerate that, because the future's kind of here and moving faster than we can. So thank you very much.